A chef ate gas station nachos for dinner. This is what happened to his limbs. GP is a 34-year-old man presenting to the emergency room with shortness of breath and blurred vision. He tells the admitting nurse that he knew something was wrong when he thought he had to burp, but a lot more than just air came up. 2 days ago, GP left home to go on a road trip. He was a chef who recently sold his failed restaurant. His life was going nowhere, so he left home with no intention of ever coming back. At a gas station, hours later, GP needed to make a pit stop. He was hungry. Coming from the culinary world, he had high taste in food, but nothing like some sketchy nachos and roller hot dogs for dinner, he thought. Immediately after finishing his gas station dinner, GP felt wonderful. He stopped at a nearby motel to finish his day. On the road the next morning, GP didn't eat breakfast because he felt like there was a rock in his stomach. As he kept driving, he noticed that it was getting harder and harder for him to breathe. His throat and chest were getting tighter. He had a history of asthma and allergies, and he's in an unfamiliar place now, so maybe close the windows, he thought. As the hours go by, GP becomes increasingly short of breath. A tingling in his fingers begins to develop into pins and needles as his vision starts to double. As he pulls into the hospital parking lot, he feels the mass in his stomach getting heavier as he dry heaves again on the pavement. He crawls into the emergency room where we are now. At presentation, GP appears ill and uncomfortable. His skin is flushed and he complains of dry mouth. Both physical and neurologic exams seem to be normal. His heart rate slightly elevated, his blood pressure a little low. If he's in a place that he's never been to before, having eaten food that he normally doesn't eat from a place that he's never eaten at, then this kind of sounds like an allergic reaction, a little delayed in onset after eating his gas station dinner of nachos and hot dogs. This anaphylaxis is pretty easy to treat as the medical team starts to give him medicines for it. They start with diphenhydramine, also known as Benadryl. This blocks a chemical called histamine, which explains why it's harder for him to breathe now. Histamine is released when the body finds allergens, which is something that causes the immune system to react inappropriately. Inappropriately in that it causes the blood vessels to dilate, allowing more of the immune system to enter the site to react with those allergens. And the swelling is happening to his tongue. It's closing up his throat. It's making it harder for him to breathe, so blocking histamine should stop this from happening. If his blood vessels are dilating, then we need to constrict them, so GP was also given epinephrine or adrenaline to tighten up all his blood vessels, causing vasoconstriction, to counteract the vasodilation because of his allergic reaction. He was rehydrated with intravenous fluids as he seemed to recover. But several hours pass. GP's vision starts to double. He describes what sounds like heartburn to the nurse. 2 more hours pass and an oral antacid solution arrives from the pharmacy for him to drink. This tastes like chalk, he thought. I really don't want to drink this, he thought. A few sips and another hour in, GP is physically no longer able to drink the rest of the mixture as he becomes unable to swallow. He frantically tries to signal this to the nurse because he's no longer able to speak now. Immediately, the medical team reevaluates GP as they draw blood from him to test. He can now only communicate with them in writing. He tells them that he feels like he's suffocating. His eyelids start to droop as his heartbeat is now a little bit elevated, and surgery and neurology doctors are called in. A new examination finds that GP's reflexes are still normal. His senses are still intact, but the muscles of his eyes now have some weakness on abduction. An MRI of his brain returns normal. Nothing's wrong here. Over the next 3 hours, a wheezing sound could be heard from GP as he tries to breathe. Weakness of his face and tongue worsen as breathing becomes dangerously shallow. An examination of his throat finds that he's unable to swallow not because it's swollen, but that the muscles of his throat are actually paralyzed, meaning that whatever is happening to him, it's definitely not an allergic reaction. Weakness in his arms and legs were found as he's admitted into the intensive care unit. At 36 hours after eating his gas station dinner of nachos and roller hot dogs, GP is no longer able to use his arms and legs. He's no longer able to breathe on his own as he's intubated and a tube is put down his throat for a machine to breathe for him. He can still hear. It looks like he can still respond to pain, but he's now trapped in a body that can't breathe for itself, that can't speak for itself, and can't move by itself. This rapidly progressive, generalized weakness descending from the muscles of his eyes to the skeletal muscles of his limbs gives the medical team some clues as to what's happening. GP's brain MRI returned normal. The weakness that he developed was symmetric, meaning that it was about equal on both sides. Together, this means that there probably isn't anything wrong with his brain or his spinal cord, something that we would call a central cause of acute weakness. The central nervous system is made up of the brain and the spinal cord, and it's responsible for the senses. GP can likely hear the medical team. He can likely feel the medical team, but he can't speak to them because his throat is paralyzed. He can't see them because he can't open his eyes. He might be able to smell them, but he can't breathe on his own because those muscles don't work anymore too. And because the peripheral nervous system operates on the muscles, then this could be where his problem lies. But how did this develop? In the emergency room, medical staff saw his problems progress from nausea and double vision, shortness of breath, to being unable to swallow, unable to speak, descending rapidly to muscle paralysis. If he no longer has control over his motor function, then this means that the problem could be first coming from his nerves only, it could be coming from his muscles only, or the problem is from the junction of where the nerves connect to the muscles. There aren't too many things that are a problem of just the nerves that cause muscle paralysis and doesn't affect the brain. Polio is a virus that destroys the nerves and causes paralysis. West Nile virus does it too. But these are just like any other infection at first, meaning that it would cause things like a fever and respiratory illness lasting a few days before causing motor dysfunction. But GP never reported a fever or recent past illness, so this is probably not a problem of just his nerves. But how about his muscles? Some muscle diseases can cause paralysis, but those don't usually affect the ocular and respiratory muscles together, so we're probably clear here too. But how about the neuromuscular junction? This specialized region is where the nerves connect and communicate with the muscles. If nothing is wrong with only the nerves and only the muscles, then it means that GP's paralysis could be because no signals are being relayed between the two tissues. You see, muscles don't contract by themselves in normal function. There has to be motivation behind the movement. Your brain controls your muscles.